I was having really crazy menstrual cycles. There was some sleep issues. I had gnarly pain. Like I couldn't eat anything with fat. I got misdiagnosed for years as like acid reflux. I got to the point where I could barely keep up with what I was trying to do. It kind of felt like I was losing control of some of my symptoms, and I hated admitting that, but I was just like, okay, well, what else is out there? Because obviously I can't quite pinpoint it all on my own, and I just wanted some extra support.
You really need to assess and sit down and find out all the factors, all the pillars of health, and like really assess and find out what is the root cause here and how can we figure this out together.
Within a couple months, I started noticing the physical aspects, like seeing results in the gym. And then it was probably like 3 months had passed, and I was like, wait, I haven't had a gallbladder attack since I started. That just was a really awesome realization that I had gone through 3 whole months without having pain in my stomach. And before that, like I have never gone more than like a week. Motherhood will change us no matter what. There's no way around that. But that doesn't mean we need to feel like crap all the time. I think we can feel different and good at the same time.
Well, first off, Lil, I want to say thank you so much for doing this. I know it takes effort and time to like get this on your schedule. You're a busy business owner, mom of 2, wife, the whole 9. So I just really, really thank you for doing this. And
Of course.
yeah, just super interested to hear more. You've been a patient of ours now for a couple months or maybe even longer, but it's interesting because you've always been, and since I've known you, like as a good girlfriend of mine, like super aware of health and wellness. And so, I've been in this business and in this space for almost a decade now. And it was interesting when we started having conversations about different things that were coming up, like peptides, or you start asking more questions. I was like, wow, even like my best girlfriends are like unaware of some of the things that could support them in their journey. And I think it's cool, like when I saw you kind of come to the table and say, hey, I need some more support. It's like, it's so interesting to me, even though you're in a good wellness space and you're very educated and knowledgeable because you are in the health space as well. That even you still needed some support. And I think that's such a great thing to empower other women. I think that's why I really wanted to have you on here today to just relate to other women who are having struggles and are just doing it on their own and knowing that like we need to ask for help. I think that's one of our challenges, right? Is like getting the support that we need or slowing down to find out if I can take care of myself, I can take care of others, take care of my family, take care of my business and so forth. But super interesting. I know you have a big story and I want to be mindful of our time together, but feel free to start where you want to start and just would love to hear more from you about how you found us, where you've been, what results you've seen, the whole 9, but we can kind of start from there.
Yeah. Well, you kind of touched on it. I did feel like I was pretty knowledgeable in the health aspect of, or at least my own health, and then of course my patient's health. But for me, it felt like a big step to sort of ask for help because I've always kind of been the type to kind of figure it out on my own. Anytime I've like had an issue, I've just done a bunch of research and was able to figure it out. And I just kind of felt like nothing really big happened at once. But after having kids, I have a 5 and a 3.5-year-old, I felt like my health was kind of going very slowly in the wrong direction. And I just couldn't put my finger on like one thing that I was doing. Like, in fact, I felt like I was being healthier than I was in my 20s. Like I was drinking less. I was eating like way more conscious of what I was eating. And I just was seeing things on blood tests and like the way I was feeling. That was just slowly going the other direction. And it kind of felt like I was losing a little bit control of some of my symptoms. And I hated admitting that, but I was just like, okay, well, what else is out there? Because obviously I can't quite pinpoint it all on my own. And I just wanted some extra support. And my symptoms mostly started, as I was saying, pretty benign. Like there was some sleep issues that were coming, but I'm a little kid. So I was just like, okay, I'm just used to being woken up in the middle of the night. So even when they would sleep through the night, I just like would wake up in the middle of the night, and I just, okay, maybe that's normal being like a new mother. And then I was having really crazy menstrual cycles, like just didn't feel like I was addressing that the way I wanted. So my doctor had put me on birth control, even though like we're not having any more kids and we already got that taken care of. But I went on birth control literally just to control the symptoms, which is like totally against kind of what I believed in the past. Like I never wanted to go on birth control just to control a symptom. I always thought I could just control those symptoms on my own. And then the biggest thing actually was my digestive issues. I had some digestive issues when I was younger, but then they kind of went away. And then after having kids and being pregnant with my first, I had gnarly pain. Like I couldn't eat anything with fat. I got misdiagnosed for years as like acid reflux, especially during pregnancy, because everybody just says, oh, you just have acid reflux in pregnancy. And, I just believed it. But then it didn't go away afterward. And I got to the point where I could barely keep up with what I was trying to do, my macros, pay attention to how much fat and protein and carbs I was eating, but like I could not eat the right things because everything just hurt. And that definitely just was getting worse and worse. So I was starting to kind of piece it together, but not really, maybe thinking this was a hormonal issue. Maybe something else that I'm missing. I'm 39 right now. And I was like, well, I'm not going through perimenopause, am I? And then I started looking it up. Oh, maybe I am. And then my mood, I'm pretty easygoing, but I did find myself getting like really frustrated easily, especially at my kids. Like if something didn't go the way I planned it to go, I just felt this like, I don't know how to explain it. It was just like fight or flight, just like, and that felt like it was happening more often than I wanted it to. And then the last thing, actually, there's probably a million things, but the last thing I can think of right now is I was working out consistently. Yes, I probably wasn't getting enough protein because of my digestive issues, but I felt like I was heavy lifting for a couple of years, like consistently heavy lifting. And I wasn't seeing the results as much as I wanted. Like I was getting a little bit stronger, but I just felt like for working that hard with heavy lifting, I should be seeing more results. And I think that was the night I went up to you. We were going to the Sophie Tucker concert, and I was just like, Randy, I just feel like I don't know. I feel like I'm working really hard, and I don't see it on my body. I don't see it. I don't know what's going on. And you were like, come into my clinic. And I'm like, all right.
Let's get you
that's kind of where it started. I know that was a long answer, but I had a lot to say on that.
No, I love long answers are great. We're here to hear your story. So that's awesome. When you say you're like piecing it together on your own, like what kind of things, I can go a whole direction with GPs and all that stuff. I think they've got a great support system for what they do well. Obviously we do things a little bit differently. I know a lot of GPs are moving into the functional space, which I'm so excited about. Yeah. I just think there's so much good information to find the root cause. But when you were doing things kind of on your own, what were you like finding, or how were you doing that before you came over to us?
Right. And I love my GP. She's great. But they're all super busy. And I know she was doing the best that she could with the time that she had with me. But it was I was getting some standard advice like, make sure you eat a lot of like beans and veggies and fruits and eat a balanced meal. But I was like, I'm already doing that. Like I'm trying really hard with that. And then I went like real crazy on AI. I was like inputting. I actually think it had some substance to it, but I put in like my genetic background into AI, and I was like trying to plug in like genetic eating and just trying to figure out like how my ancestors ate. Like I went crazy because I was just like, what am I missing with what I'm eating? Like, why am I getting stomach aches and all these issues? And then my husband next to me is eating like freaking double cheeseburgers from In-N-Out, just with like no issues at all. And I had like 2 bites of that cheeseburger and my stomach is killing me. And I'm just like, why? Like, I don't get it. So I knew there was a component. I feel like whenever I can't figure something out, I don't ever think that there's not a solution. I just think there is a solution. I just haven't gotten there yet. And I just need somebody to like connect the dots or something to just happen for me to just realize like, okay, that's what I need to do. And I'm going to go for it.
Yeah. Yeah. So then when you came with us, I know we obviously do our initials differently. We do huge, big blood panels and things like that. What were some of the things that you noticed when you onboarded with us that was different, or maybe some ahas that you noticed that was just helped you get you on the right track?
So the comprehensive blood work was a big one. You guys definitely took a more vast panel of a lot of different items that I previously hadn't been doing. But then also for some of the items that I was paying attention to, like thyroid levels, sex hormones like progesterone, estrogen, you guys were telling me, or Vanessa was telling me, that some of these are suboptimal, even though with my GP, they were considered a normal range. And so anytime I would complain about symptoms, I think a lot of my doctors would have said, these all look normal, like you're within a normal range. And like my TSH was climbing. And I'm like one of those people that pays attention for years. Like I watch the graphs and I could see my TSH like starting over here at like 1 and then just like climbing over time to 3. And everybody kept saying it was normal. And so Vanessa was like, I don't really consider that optimal. And it just felt nice to hear that, because that kind of validated how I was feeling with some of these symptoms.
Yeah, I love that. Yeah, I think it was so funny. I think there was a couple times you, me, and China are just like hanging out, and you guys are asking me 1,000, even Aisha. And I'm like, I love this, and I'm so for it. But if it's not pertaining to me, I don't absorb it as much. And I'm like, go see my girls who like love and are obsessed and very passionate about the different ranges. I mean, there's education out there all the time, different researches, different like stats that are coming out that are so like ahead, that are just like, get what you need. And that's why I loved, after you went through the consult, you're like, learned so much. So I know you love that stuff and you love the education to be able to be your own advocate.
Yeah, I think it's great. And also what Vanessa did really well is really connecting the female hormones to some of these symptoms, or like other hormones or other blood markers that are changing. She would explain how these sex hormones like estrogen, progesterone would affect these blood markers. And I always knew that in the back of my head. I have like some knowledge of how hormones affect the body, but to hear things like, oh, it affects your digestion and stuff like that, I felt like that was kind of what I was missing, and when I was trying to figure everything out.
Yeah, that's awesome. When you started going on your treatment plan, what sort of things did you start noticing that were different, or that like started giving you good results?
So right away, I mean, I got everything right away. I didn't waste any time. And this is better than what I've done with naturopaths. I went to a naturopath in the past and they gave me like a bunch of supplements and I literally like took them for a week and then stopped. But I actually stuck with everything. So within a few days, I started noticing that my sleep was improving. I did notice my mood getting better almost immediately.
Nice.
And then within a couple months, I started noticing the physical aspects, like seeing results in the gym. And then it was probably like 3 months had passed, and I was like, wait, I haven't had a gallbladder attack since I started this. And so that really surprised me, because I honestly don't think when I went in, I thought that was going to be resolved. And so that just was a really awesome realization that I had gone through 3 whole months without having pain in my stomach. And before that, like I have never gone more than like a week. So
That's
yeah, what
incredible.
else? Yeah, no,
That's
super
awesome.
great. So I started in October, the program. And then by
Yeah.
December, I got my IUD removed, my hormonal IUD. And then Vanessa guided me through that process of, we'll increase or decrease your bioidentical hormones based on how you're feeling. And I started to feel pretty good. I mean, I had a couple swings after I got the IUD removed, like just random lack of sleep for like a few days, or like I felt like my hormones were kind of doing this just for a couple of weeks, but then it really leveled off. And so by like the end of January, February, I felt really good.
That's awesome. What do you think pushed you? Like, I'm curious to know why this time around you took it more serious than the last time. It was like you got your supplements right away and all that stuff. Like, what was the motivating factor for you?
Actually, okay, this is like a little personal, but I'll just say it. So
Yeah.
my
Totally.
like now that I'm a mom, I started just kind of like remembering some health issues that my mom had, and some like she's not with us anymore, but just like some just really crazy issues and mood swings and things that just I wish doctors could have taken better care of her, so she could have done better. But that time passed, so I was like, well, I can't help her anymore, so at least I can be the best mom that I can be by getting my health like under control now. And then as perimenopause and then eventually menopause comes along, I can just be better prepared, both hormonally and then nutritionally, and all the other advice that Vanessa gives.
Gosh, I love that so much. You just gave me goosebumps.
I know, I was like trying
I'm
not to
like,
cry.
that's what I know. I can feel that too. It's like, that's why I love this business. It is like, it's more than just like fixing people who like need some more support with their health. It's like, how can we be better versions of ourselves to then ripple into our families and our community to like make a better life and make a better world? Like, I'm on that deep level. I mean, you know that about me. So it's
Yeah.
like, we have to take care of our health. If we're not functioning in our bodies, how can we function out there in society and be the best version of ourselves that we can? So,
Well, I know it's crazy. And I can think of, I mean, I'm sure like a lot of people can think of either their mother or just like another female in their life that's older now, that I just wish like some of this information was there for them, and I think we're lucky to, in this world, to have more science directed at like, how can we move through the next stage of life gracefully and have the support.
Yeah,
Because I don't think
100%.
the women before us had that.
Yeah. I think too, we're in a really lovely Santa Barbara bubble, and our group specifically, and like health conscious, but I find that there is still a lot of people who it's like, fix it when it's broken. It's
Yeah.
like, we're just so busy doing all the things, being all the things, taking care of everybody else. And I think it's so important for women to hear that story of like, taking care of yourself is super important, not when it's broken, because it can be too late. And then you have to go down, kind of like what you said, that rabbit hole of finding out all the information on top of doing all the things you're already doing. It's like another full-time job,
Yeah.
and then trying to assess and then doing it on your own and then feeling like it's not working and then getting frustrated over here. It's
Yeah.
like asking for help from the right people, the right support systems is huge, huge deal.
And I get obsessive. Like I'm like a spinning top until I figure it out. So it's like, it's nice when like somebody can help me figure it out, because I will keep spinning until I do figure it out. So
How long were you having those symptoms and things beforehand, before it got better? Like, how long were you doing that?
before I started the program,
Yeah.
yeah, it just was so gradual. Because like
Yeah.
I was saying earlier, there wasn't like one event where I'm just like, okay, I need help. It was just like the sleep, but then the sleep when you have a newborn, you already know that's going to be screwed up, and then you just think it's going to get better, but then all of a sudden you're like, oh wait, it didn't fully rebound to how I was before kids. But then your mind's like, well, maybe that's just normal because you have kids, and maybe it's never going to be fine. And you just you kind of like let a lot of things slide as symptoms start piling on. Especially with the mood. I was just like, well, I'm busy and my husband's a firefighter and I'm solo parenting a lot and I have the right to be like annoyed and short tempered. But then I was like, well, why? And I actually just recently, after I was already feeling good, thankfully, but I just read this statistic about like how we think, or it's more of a hypothesis about how like 50% of marriages end in divorce. And the hypothesis is that because like women are going through menopause and having these like crazy symptoms and like crazy rage symptoms. And like I've never gotten to that point with my husband, but I was just like, I'm glad I'm getting this taken care of, because it's kind of crazy to think you might not have control of your emotions and your anger and frustration in front of your family. So I wanted to kind of nip that in the bud before it got bad.
Yeah, well done. Like huge kudos to you, because I think that's a big part of it. We see a lot of women come in and have these, and then their husbands come in, or vice versa. The husband will come in and say, "Hey, do you think maybe you could treat my wife?" And then she comes in, she's like, "I don't need this," you know. And then they
Right.
come up, they find out all this stuff, but then they're both supporting each other in their health journeys to, you know, get them both on track, because, you know, everyone goes through hormones differently and different genetics, the whole thing. So it's like you're on your own individual journey, but to have that support of somebody who, and your partner who cares enough to be like, let's get you some more support and find out why. Like, let's get to the root cause. I think that's the biggest thing that we see in our practice for sure.
Yeah. And I can already hear the counter argument in my head of people saying like, well, we shouldn't give women like something just to fix the marriage. But I don't see it like that at all, because I just feel so much better in my body. And the things that were offered to me, especially when I was really struggling after my first kid, I had a lot of postpartum anxiety because it was COVID. Everything was traumatic. I had just lost my mother and I just had a hard time with anxiousness. And the doctors were pretty much, and I was just like a few weeks out, and they were like, here, we'll take this antidepressant. And I was like, what? And they're like, yeah, no, you need to take this. It's going to help you get to the next level. And like, you're not going to be able to feel good on your own. Like and I got like pressured into it. And I was just like, I don't know how I was in the right mind to say no. And I have nothing against people that choose that route. It just wasn't for me. And somehow I was able to kind of get through the pressure and say, no, I don't want to take that. And I started to get, you know, a little bit better on my own, but I just felt like, you know, they're pushing all this kind of stuff like antidepressants on us to kind of get through life, when really we might just have hormonal imbalances. So it just feels like the right route to make you and not try to change who you are as a person, or you know, change me as who I am. It's just supporting what's already in there.
Yeah, no, I love that. And I think that's what's so cool about our providers. We had Tiffany, I don't think you've met with her because you met with Vanessa, but she's our telemedicine provider and she came from a different clinic. And I asked her, what is the reason you want to come here with us? And she said, because you guys spend a lot of time with the patient and the follow-ups are so consistent. She said in other practices, she goes, I'm seeing patients in like 20 minutes. She goes, the over-encompassing like information I had and things that change often within like a woman's body, but also in her time and in her life, like a lot can happen in 90 days that you really need to assess and sit down and find out all the factors, all the pillars of health, and like really assess and find out what is the root cause here and how can we like figure this out together. You know, she's like, it's not just like, okay, you're fine, you're within range. That line drives me nuts. You know, you hear that so much. And it's not
right,
so
what
much
about my symptoms?
Right. And it's like, there's labs to have the backup proof, but like treat the patient, listen to them. But 20 minutes or pushing patients through like that, how are you going to ever give that person that support that they need?
Right.
It's wild.
I know. I love Vanessa spends a lot of time with me, and I look at the clock and like I realize we've both been talking an hour, and I'm just like, oh my gosh, am I taking too much of your time? And she's like, no, this is like what we're doing. And so I'm just I'm just like used to that with like my doctor. I mean, I'm the type that will like just keep blabbering, but I like cut myself off sometimes because I'm just like, oh, don't you have to go? And but she was just like, no, this is fine.
Yeah. What are you seeing in like, I mean, tell us a little bit about what you do in your business and like not maybe so much within your patients, but even in just women in general that you wish was a different topic or that they had more information that you know now, like that you're just like, I want to tell the world like XYZ. Like, what would you say?
Yeah, well, so I'm actually a pelvic physical therapist. So I deal with women's issues quite a bit. And that's why I was saying earlier, I do have a baseline knowledge of hormones, especially as it relates to the pelvic floor. So I feel that in the past, I've always told patients to basically go see somebody to get their hormones under control if they're having XYZ symptoms. Just for like a little summary of some of the symptoms or like a little quick bit, but frequency of urination at night or pain, pain in the pelvic floor muscles or like pain with intercourse, things like that, that just kind of came on suddenly. I always want them to go get their hormones balanced. But I didn't really know who to send them to. And to be honest, one thing I didn't realize was that I was on hormonal birth control, which is progestin. And I was always told, no, you're getting progesterone put in your body. So you are on hormones already. But then Vanessa was like, no, progestin is basically like a fake progesterone and your body doesn't recognize it the same. So your body actually produces less progesterone. And you end up having, all these issues because of like the imbalance of your hormones. So like the birth control, the fake one, actually throws your body more out of alignment. And I did not know that. I thought it was the same thing. Progesterone and progestin acted the same way in the body. My OB, actually, my OBPA, she thought the same thing. She was like, no, those are the same thing. And I was like, no, it actually acts on your body in a different way. And so I ended up sending her articles about how women on progestin, hormonal IUDs, have an increased risk of gallbladder removal than women that are not on it. And so that showed my PA, not Vanessa, but the OBPA, that this acted different than the progesterone. And so when I started taking the bioidentical progesterone, I had way better improvements in my body. So to go back to your question about how I'm going to use this with my patients, like that is a huge one because up to this point, I really thought those were kind of similar for the way it acts on certain receptors in the body. Also, you guys really inspired me just kind of in this journey that I'm taking some professional courses through Herman and Wallace, which they do all our pelvic floor courses on menopause and perimenopause. Cause like, I just want to like dive deep into the hormone world. Like I said, I think women are just so underserved, or at least were underserved in that realm, that I think everybody that works with women should really dial down their knowledge of hormones.
And it's vast. It is wild to me too. When we got back after Houston, because we opened up that clinic in Houston, he was just doing men. And then we came back and he just wanted to do men. I'm like, what about all the women? And he's like, women are hard. Like women are challenging because you have so much going on. You have so many different hormones and you have all the emotional stuff. Like, it's just like, he goes, women are really challenging to dial in when men are more simple and they're very direct and clear about what their symptoms are. And women have such a different range.
It's such a range. Like, all through our cycles. And then, like I said, I had the knowledge on the hormones onto the pelvic floor and the symptoms you can get from that. But I just didn't realize the digestion and the cardiovascular, and like women are having like these heart murmurs and heart issues. And it actually has to do with their progesterone and estrogen being out of whack, or testosterone even. And it's just it's like one of those things where you're like, okay, I'm just going to like read a little bit more so I can feel more knowledgeable in this subject. And then all of a sudden you're like, wow, I think I know even less now. Like I realize like I know nothing. There's just so much. It can just go on and on. So yeah,
Yeah.
women are complicated, but we're worth it.
Yeah, we're so worth it. Power to the women. No, that's awesome. No, I would love that. And I even think there's some potential to do, women's workshops and get together and really just educate women. Cause it changes, like last year I had different symptoms that I'm having this year. And it's wild. Even the resources I have, when you get stuck into like a rut, it's like, hey, wait, let's just start over. Let's get the baselines. Let's redo. You might know what worked last time doesn't work for me personally anymore. So I'm always trying to change it up. But it is good to be aware. And yeah, I think it'd be fun to do some kind of women's retreat or something fun like
Oh
that.
my gosh, I would love that. And I feel like women our age, like in this like late 30s, early mid 40s, this like perimenopause window, this is like the most important time to educate women so that we're like prepared for the transitions that we're all going to face, mostly in our early 50s, but for some of us even earlier than that, because that's like it's like 10 to 15 years of perimenopause, which is like hormonal swings for 10 to 15 years before you like finally have your last period. And I just think we need to learn, we need to have the tools now so that we can just feel good as we age. And so I think a workshop would just be an amazing idea. I love that.
I think education is so key. And I think too, I know women talk more than men, right? Obviously and they're more vulnerable about what they're experiencing. But I always find this in a group of women, there isn't a lot of answers, that's like their own little story and their own like symptom. And they're all still at the end of it. They're still like, okay, well now what? It's like,
right.
Gotta get
Yeah, no, I feel like, and it's so negative, like the conversation about it. Like I was talking to one of my girlfriends and was telling me, she's like, oh, I'm 42. I'm going through perimenopause. It sucks. And I was just like, oh, well, did we have a solution for this? Like, what are you going to do? Like, what's the plan? And I feel like that's, especially like on social media, it's all about just like, this sucks, perimenopause, and XYZ is happening in my body, when actually this is just such a golden opportunity for, like you were saying, like, what are we going to do about it? Like, let's have a plan. Let's like make ourselves feel better.
Yeah. Yeah. It doesn't have to be, I feel like crap and this is how it is. Like,
Right.
no,
It's easy to
we don't have to live like that. Yeah.
Yeah.
Wild.
Yeah. You see like a lot of stuff on social media. It almost kind of like glamorizes, I don't know, victimhood is the right word, but just kind of like, it's okay to feel like crap, because I feel like crap and you feel like crap. So this is normal. And there's something that we say in pelvic therapy. It really has to do with incontinence and peeing yourself, but we say it's common, but it's not normal. And so that's just like a phrase that we can say for a lot of these symptoms, mood swings, sleep, all sorts of weight gain. It's common, but it might not be normal for you. So I think getting it checked out is important.
I think that's also interesting. I mean, you said it too, and I do it as well. It's like you go down the rabbit hole and you find things on Instagram that you can identify with, and you're like, oh, that's kind of me. Maybe I should check that out and this out. And it's like we lose that, like, you're your own like radar. Like intuition is a huge deal. Like, actually, I just need to find a partner to help me with these pieces. Like we're so like trial by fire and just try it on ourselves. Like, yeah, I'll just conquer it. I'll just figure that out. I'll figure this out, figure that out. And then like a couple years later, you're still feeling like crap. And it's like defeating. It's like, it doesn't have to be that way. You got the right information.
I agree. And then especially with like certain tools like AI, Chat GPT, like can at first glance seem really beneficial, and it is, but like sometimes like those robots put you in circles. Like they're just like, yeah, validate like how you're feeling and like try this, and you're like, that didn't work. Oh, you're right for that not to work. And you're just like, what? And like it makes you feel like a crazy person. So it's like sometimes it can be useful, but then sometimes it almost like makes things worse. And I kind of felt the same way about even trying like an online provider. Like I know a lot of people, I get a lot of advertisements for these like online peptide and hormone providers. And I just think that's kind of like we're like so many questions. Are you getting the same person each time? Like, how often can you correspond with them? Like, what are, like, do they know your lifestyle? And like, Vanessa lives in Santa Barbara. I live in San Ynez. And so I feel like she kind of knows what I'm surrounded by, and kind of understands like the way we think and what we like to do up here. But like with an online provider, I was just, that just like felt weird. Like hormones and like peptides, I want somebody that really knows their stuff and really cares about my safety.
Yeah.
And not just like some rando.
Well, it's a relationship, especially if you're meeting that person over time. Like you said, you want to be switching all over, and maybe that provider has a different idea of what they should be treating them. And like you're switching back and forth all over the place. It's like, not going to work over time. You need a consistent plan of somebody who's going to work with you. Yeah, totally. For sure.
Motherhood will change us no matter what. There's no way around that. But that doesn't mean we need to feel like crap all the time. I think we can feel different and good at the same time. And so for me, it's somebody that is willing to hear all the symptoms, willing to also hear some of my theories about why I'm having certain symptoms, because I think a lot of women are pretty intuitive and they kind of know what's going on already. And so basically listen to women as they say, I'm feeling X because of ABC, and try to run with that instead of, there's some providers that will just dismiss that because it doesn't fit in their mold. And no, that couldn't cause that. That you have normal blood tests, and you're not feeling like this because of your hormones, and just kind of brushing it off. So finding a provider that actually will listen, test your theories, and explain to you why your theories may be correct, or maybe guide them into the right direction if not. I've had good doctors and okay doctors. I've had doctors dismiss some theories that I had, especially like about my gallbladder. Well, maybe something changed after having kids, and nobody really kind of said, oh yeah, hormones change after kids, and that could be why you're having pain. Or that time where I was heavily pressured to start an antidepressant, even though I said I was really uncomfortable with that, not because I think that they're awful and they don't work for some people, but because I had a personal reason with my mother being on them that I did not want to go that direction. And I didn't feel very heard in that scenario. So it was nice. I wasn't even, antidepressants for anxiety weren't even brought up with Vanessa, which was great. It was just like, let's look at your blood work and fix that. And that's what helped. I'm trying to think of any other times felt I got that roadblock. For the most part, the roadblock with the gallbladder, not with my particular doctor, but things I was just kind of reading online that said, if once you have digestive pain and gallstones, the only way out is getting your gallbladder removed. And that seemed like a consistent message across the board, and like all these message boards and things like that. And I just felt like, really, there's no other way to get rid of digestive pain than getting like an organ removed out of your body. So, that Vanessa didn't really have that attitude at all about it. Like, oh, you've got gallstones, there's nothing we can do there. Like, there's only one way out. She was just like, well, let's try these things.
Yeah. See what works. Not like, that's the one thing that some doctors would be like, they will never say, I don't know. Or like, you know what? That's interesting. Not heard of that before. Let's dive deeper.
Yes. You know what? That is a huge thing. And that's why my OBPA that I was talking about earlier, I loved that she was willing to get the research from what I learned from Vanessa. And I actually sent it to her, and she was really receptive to that information. But I feel like a lot of doctors out there would not ask for that research and would just say, oh, like that's how I thought it was, so that's how it is, you know. And I think as medical providers, because I'm one too, we don't even scratch the surface to knowing everything about how the human body works. We think we do, but like the more you know, like I said, the more you realize you don't know. And so I think it's so important to be open to changing your mind on things.
Yeah, totally. Lily, I just really appreciate this time with you. Mother of two, business owner, your own health advocate, and a woman supporting other women. I also love that we have women in our clinic that really want to listen and educate and really be your partner in your health journey. And knowing that Eternity Health Partners is one of our biggest missions is to do that and to provide the education and the support to get the help what we need so that it does ripple through yourself, within your family, and throughout our community. So knowing that we're here anytime you need us, it makes me super happy to be able to provide that support, not only for you as a patient, but as a dear friend of mine too. So I'm so glad you found us and are here. Yeah. Thank you so much.
I'm lucky to have you.
Yeah, me too.